this is our best chance. And it may be our last chance to understand the origins of this virus. That is a human endeavour to understand a virus that has stopped our whole world. And I would ask everyone, countries, journalists, and everybody else, to create a little space for that discussion to happen.
Let's discuss this with Mukesh Kapila. He's an emeritus professor of global health and humanitarian affairs at the University of Manchester. He's also the former director for emergency response at the WHO and joins me from Geneva. Prof, great to have you on the program. Appreciate your time. Just talk us through the differences between this new group and the one that was sent to China in January.
I think WHO was very embarrassed by the first investigation, which was under the control of the Chinese authorities and limited by the access and information that the Chinese authorities could provide. WHO was embarrassed by the outcome, which was a very poor study. And obviously, even WHO's Director General himself said it wasn't sufficient. So now what WHO has done is a very clever move. And that is, it has, instead of appointing a very narrow window committee, it has set up a standing body, a strategic advisory group. And I'm a member of another strategic advisory group on another subject. So the way these groups work is they take a long-term approach to the problem. And we know that new information is going to come out sooner or later. The second way this group is clever is that this committee is not dominated by China. And it's also linked, perhaps, to the longer-term objective of looking at other coronaviruses and other causes of future outbreaks. And when you put this alongside other attempts at WHO, for example, the creation of a new pandemic center with the cooperation of the German government to look at the rise of pathogens around the world that could cause future pandemics, this points to a holistic approach from WHO, which I think I'm optimistic that this will allow the world to move forward. But I think Mike Ryan is right that probably we're not necessarily going to get too much new stuff in terms of the COVID-19 pandemic. However, new science and technology is evolving all the time. And it may well be that in coming months, we might get new information that will allow the group to give us more definitive answers.
But Prof, the big question here, though, is China going to allow this WHO group to go into Wuhan, to come into their country, to do another investigation?
Well, that remains to be seen. And I would I would say cautiously optimistic, but at the same time pretty pessimistic. But it may well be that by the group recommending new types of studies that can take place, what will happen is that it will set in motion a program of action that doesn't require all the questions to be answered immediately, with immediate access. It will be very difficult for the Chinese authorities to withhold cooperation over months and years to come. So I think we need to approach this in a long-term way. And I think the Chinese authorities, who are in the dock enough as it is, are not likely to be able to survive this if they do not cooperate with such a world initiative, which has scientists from all over the world in it.
And Prof, I would imagine that understanding and knowing the origins of COVID-19 will help scientists and researchers prevent at least future pandemics. But we've already had so much information since it was first detected, I believe, in December of 2019. Is that being used in a constructive way? How is that being used to help us foresee future pandemics and to prevent them?
I think we've learned a huge amount over the course of the last 18 months about not just about the coronavirus, but about pandemics in general, including strategies for prevention, for control, for treatments, and so on. So in that sense, much of the knowledge that has been gained, triggered, if you like, by the response, by the emergency response to COVID, it is being put to wider use in terms of strengthening capabilities around the world. For example, early warning systems, for example, strengthening surveillance, for example, strengthening laboratory capacities to be able to track these pathogens, viruses, and others that are likely to cause future outbreaks, which can turn into pandemics. So in that sense, I think there is the world is in a very different place in 2021 than it was in 2019.
Professor Mukesh Kapila, really appreciate your expertise on this. Thank you so much.